everything look good, including being overweight. So, you know. Scientifically, you cannot drink alkaline water and it makes your cells alkalytic. The closer you are to nature, the healthier you'll be.
All right. Happy Saturday, everyone. You are in the Mind of Nature, hosted by Dr. Zarif, the nutritionist. Thank you all so much for being here. We have some great topics lined up for you today. As you are coming in, please go ahead and share the live. Share the live. We are live streaming on Facebook, we're on YouTube, and we are on Instagram. So, again, come on in and be a part of the conversation. We have a great um, group of topics lined up for you today. We are talking about new and emerging virus variants, also how virus spreads in a connected world, and also prevention, vaccine, and public health response. If you guys haven't been watching the news, or if you have been watching the news, you will see that there's a lot going on when it comes to different viruses, and Dr. Zarif is going to help us understand what is going on when it comes to different viruses and things like that. So, Dr. Zarif, go ahead and join me here on stage so we can get started. Hello and grand rising to you.
Grand Rising to you also. Thank you so much, Carolyn. Let's get right into it, everybody. We're talking about people. Today we'll be discussing people that actually, when I'm talking about black folks in our community that are continuing to spread the diseases that are killing us kind of quietly, but it is something that is happening that we need to make more noise about. So that's what we're going to be doing today. We're going to talk about these things, these different diseases, because with these different diseases, we can actually, once we know how to identify them, you know, what to look for. And the thing that's important is that we have some kind of understanding about what these diseases are. Now, some diseases have decreased in the black community over time because of better awareness, screening, the treatment, and public health programs. However, other diseases have increased or continue to affect black communities at higher rates due to the healthcare access gaps, the environmental factors, the income inequality, the stress, and the systemic disparities. So I'll go over just some of the things that you should keep in mind when we're talking about these disparities. Diseases that have shown improvement, the HIV, AIDS, and death rates. And now the good thing about this is that yes, they have these rates have declined with better treatment and prevention access. Then there is the certain cancer survival rates that have improved because of the earlier screening and treatment advances. And COVID-19, well, what is it? Yeah, we have to still find out more information with it. I personally not satisfied with what has been reported about it, but COVID-19 mortality disparities narrowed after vaccine availability increased. So this is something to keep in mind for those that are against vaccines, or they feel like or believe that certain reactions or certain illnesses and the display of illnesses are, like these are the reasons that for certain other diseases. For instance, to get straight down to the point, when people think that they're taking vaccines, that they also open the can of worms, so to speak, for other diseases. And this may be the farthest thing from the truth. But if you don't know and we don't keep studying and we don't keep a tab on ourselves, so to speak, it's very easy for us to fall into the hands of just misinformation, disinformation, and this society can be rough sometimes, because when it comes to making money, it's just follow the money and we'll find out more about the diseases. And that's a rough one, because when it comes to money, it can really, really get weird out there as far as how much money can be made with certain things that can be detrimental to humans themselves. Look at the war. I mean, look, people killing each other. It's like, yeah, you got to go so that we can make sure that we have, our plan is successful. They'll say. You see, so it's just that is something to keep in mind. Now, diseases that remain high or have increased are type 2 diabetes, and remains disproportionately high in many black communities. And then there's hypertension. Now, hypertension, and this is high blood pressure or essential hypertension, and this is where that this particular disease actually continues to affect black adults at some of the highest rates globally. So this is where we have definitely when it comes to the diseases that remain high, we need to bring that more into focus so that we can do something about it. Obesity, the rates have increased in some populations. Maternal mortality, black women in the United States still face significantly higher risk during pregnancy and childbirth. And there is the ever popular Alzheimer's disease. Now, research suggests that elevated risk factors in black older adults. So the like over a certain age, 60, 70, right in there. That's if you in the neighborhood of those ages, that can be something to be concerned with. And how do you get beyond that? Again, we'll be talking more about the annual examinations. This is so important. Black and African American communities face profound health disparities that lead to disproportionately higher rates of infection, severe illness, and mortality, and several viral pathogens. Public health data and systemic research demonstrate that these outcomes are not caused by genetic differences, but rather by long-standing social, economical, and environmental inequities. This is really important to know, because when you don't acknowledge the health data and systemic research that demonstrate these outcomes, then what happens is we rely on things that are just, in the street, so to speak. It becomes a part of street talk and conversation, not a part of facts and science. The key viruses impacting black communities, there's, let's start off with HIV/AIDS. Now, black Americans represent roughly 12% of the United States population, but account for more, or account approximately 40% of all people living in or with HIV. Again, roughly we make up 12% of the United States population, but account for approximately 40% of all people living with, that's all people living with HIV. That's, we have work to do here. According to the data from the Office of Minority Health, or OMH, Black individuals are more than 3 times as likely to be diagnosed with HIV as the general population. And Black women are disproportionately impacted compared to women of other racial backgrounds. So this is something to take into account. HIV and AIDS is still here. Just because you don't see it on TV as much as you used to, don't think that it's gone. It's still here. Maybe some of the marketing has changed, but HIV is definitely thriving, and it continues to do so. And we have to do something about that, because if not, it will kill, as it has been over the years, our loved ones, and we could be endangering our own health. So that is one of the key viruses impacting Black communities. Another is the viral hepatitis. Now, this has definitely been a whole sleepy, you don't even hardly hear of hepatitis anymore, but it is alive and well when it comes to viral hepatitis, according to reports tracking viral hepatitis and Black/African Americans. Black adults experience the highest rates of acute hepatitis B infections in the country. Black adults, connect that, Black adults experience the highest rates of acute hepatitis B infections in the country. Now, additionally, Black Americans are twice as likely to be infected with hepatitis C and are 60% more likely to die from it than the United States population. 60%, over half, 60% more likely to die from viral hepatitis than the total United States population. So that's something that seems like specifically Black people are really affected by it. And we need to, again, wake up and do something about that. Let's move on to respiratory viruses. Now, some of the diseases that we're going to be talking about, and most of them are respiratory viruses, or there's some kind of respiratory problem, breathing, for instance. And this is really, if you've ever had any problems, even when you compromise your breathing with a stuffy nose, like for instance, the temperature may cause you to be stuffed up, have the stuffy nose, or if you have a cold, or if you have a fever. These kinds of things are, these diseases are very, very, and illnesses are very important to have some idea of where you stand with them, because a little bit can turn into a lot, and a lot can be very dangerous. Studies published via the PubMed Central confirm significant racial disparities in the occurrence of severity of respiratory viruses. So the PubMed Central confirmed the significant racial disparities in the occurrence of severity of respiratory viruses. This is facts, in other words. And you can use this if you want to research this information on PubMed Central. You'll find it. Now, during major outbreaks, Black individuals have experienced hospitalization and mortality rates roughly 3 times higher than white individuals. Not that we have to compare ourselves with white people, but when we look at people that we live in the same areas, we eat basically the same food, but the other things that we have to deal with is how much do we exercise? How much do we gather for human touch? How much do we allow things to bother us, those things that will stress us out, so to speak. So we have all of these things to keep in mind as we continue talking today on trending viruses in Black communities. This is the Mind of Nature, and I am Dr. Zarif, the nutritionist. We are going to go back to Carolyn and see if we can give some shout out. Thank you, Carolyn.
Thank you so much, Dr. Zarif. I appreciate it. And thank you to everyone that's joined us here. We are live streaming on Facebook, we're on YouTube, and we are on Instagram. So let's see here. Rachel Taylor saying Grand Rising. I appreciate you joining us today, Rachel. Thank you so much. Glenn Johnson, greetings of love and light, my family. Glenn, thank you so much for joining us. We appreciate it. Also, Denise, it doesn't say Denise Kane, but I know that's Denise Kane. A beautiful morning to you as well, Denise. We appreciate you being here. Leah Long, Royal Rising, um, thank you so much for joining. We appreciate you. And those over on Instagram as well. Thank you guys so much. We appreciate it. We are, Dr. Zarek and I, or discussing different viruses that's specifically um, just in the Black community and things that we still need to be aware of. Because I know, Dr. Zarif, you mentioned HIV being one of those, and then also COVID. Viruses that we don't hear about it, but just because we don't hear about it, it doesn't mean that it's still not there and it's still not something that we need to be aware of. So that is what that's what we were talking about. I saw you
Yeah.
take a drink. I'm sorry.
No, no, that's right. That's absolutely right. So, yeah, and that's what we'll be discussing today. And just because you don't hear about it doesn't mean that it isn't there.
Correct.
And I think that's the point that you're making. Before I go on, I want to welcome Charles Bullen Music. Thank you for being here. Also with Sky Aim Productions, thank you for being here. And I Love Michelle is in the house. Thank you for being here. Rachel Taylor, a long, long time. Man, I thank you for being here, Rachel. It's so good seeing you. Another brilliant woman, and perhaps we'll have her on the show so we can add her to some of our conversations. But Rachel Taylor is just absolutely wonderful, and thank you everybody else. If you're listening from YouTube, please subscribe. We would love to have that. That will really make a big difference in our the way that we're represented by the people. You'll like if you like what you hear, continue to support us by liking us and subscribing and sharing. Today, would love for you to share this information because it is something that is going to wake us up for those of us that haven't really thought about some of the things that we're discussing today. Care?
Yes. Thank you so much. And those are my shout outs. So I'll just send it back to you.
Okay, so let's continue, everybody. Appreciate it. Now, first, we want to start off with the structure and the social drivers of health disparities. Now, the disproportionate impact of viral infections is heavily driven by the social determinants of health, and that's SDOH, which create barriers to prevention and treatment. Now, the excess barriers, we'll start off with that. Excess barriers are the disparities in insurance coverage, the transportation options, and the geographic distribution of medical facilities restrict access to timely viral screening, vaccinations, and antiviral therapies. So, all of this is really important here. What I just said is just the medical facilities restrict access to timely viral screenings, and vaccinations, and antiviral therapies. And what I'm talking about now are the social drivers of health disparities. So we want to make sure that we are open to and that we seek out. Viral screening, very important. Vaccinations, very important. And antiviral therapies. We have to talk about the economic factors, and some of the economic factors are higher concentration of black workers in essential frontline service roles limits the ability to isolate or to work remotely, significantly elevating exposure risk during public health emergencies. So economic factors definitely on the list also, and your frontline service roles limits the ability to isolate or to work remotely. So we need all of these things that doing these things, working remotely, reducing commuting, all of those things are very important when it comes to the reduction of the disparities that we face on a daily basis. Housing and segregation. Dense multi-generational living arrangements driven by residential segregation accelerate the community transmission of the airborne and respiratory viruses. So it's super important for us to know more about the diseases, especially some of the diseases that are pathogens, that are the air that we breathe. Something as simple as buying green plants and putting them around your home, which is reminding me I have to replace my. It's time for me to replace my the plants that I have. But anyway, if you haven't gotten any or you don't have any, add that to your list of getting things so we can keep that family nice and healthy. So you can also get your examinations, and so you don't have to dread finding out news about some kind of disease that you have and you didn't know about it, and it's too late to do anything about it. So, and that's just a reality. Some people, it's always time. If it is, it's very, very rare. So we definitely want to acknowledge that. Now, when it comes down to, I'm going to go back here for a minute with the housing segregation, dense multi-generational living arrangements driven by the residential segregation accelerate the community transmission of airborne and respiratory viruses. So we need to take care of our homes better as far as the circulation. Ventilation is very important. Circulating that fresh air, getting plants there, making sure that if you have any types of plants that you can put into your bedroom or what you like in the kitchen area, that's very important because we spend a lot of time in the kitchen. But just change up a little bit, change up that we talked about making that kitchen to your little clinic, so to speak, where your healthiest foods or healthiest supplements are there to help you to overcome any type of challenges with your health. Now, pre-existing health inequities, we're speaking about the systemic barriers that contribute to a higher baseline rate of chronic conditions such as asthma, diabetes, hypertension, which drastically increase the severity and the mortality risk of viral infections. Then there is the medical mistrust because of all of the stuff. I don't know. People always they'll say tisk uh, um, Tuskegee. Who are these tongue twisters? But all of the syphilis experiments and stuff that were done on black people, these were all done on black people. I have, if there are some experiments that were done on white people, I do not know anything about that. I can search a little more for it. If you do know, please put it in the comments. But when you know that over the years, the type of history that we have, unfortunately, we have people that are wonderful and that care about our culture, and then you have other people that don't understand us. So therefore, they get angry, and when people get angry, they want to hurt, and people that they want to hurt, they want to kill. So, and that's how man has been thinking for centuries, and that's what we're still up against. Now, the medical mistrust is historical and is ongoing experiences of the systemic racism and bias within the health systems. They have fostered a deeply rooted protective mistrust in medical device and clinical trials among many of black individuals. The medical mistrust comes from, again, the misinformation and the disinformation that we continue to have. And remember, if you don't have facts there, more likely you're going to react to the things that people tell you. And it's like, oh yeah, what? So it's like, stick to the facts and stick to the science. When it comes to the health disparities and are different, or are differences in the incidence, the prevalence, and the mortality of disease and the related adverse health conditions that exist among specific population groups. Now, these groups, they may be characterized by gender, age, race, and ethnicity, education, income, social class, disability, geographic location, or sexual orientation. These health disparities are one reason why HIV, viral hepatitis, STDs, and TB, tuberculosis, have the greatest toll in one population group over another. So these disparities are one reason why HIV and the hepatitis, the viral hepatitis, STDs, and TB are taking toll on one population, which is the black population, more than the other. So you can find information about how these diseases affect African Americans and black populations by doing, your research. I'm going to stop here so we can have a little conversation. If you have any questions or you have some comments, we'd love to read them at this time. We'd love for you to comment if you enjoying yourself. Put very interesting, and let's fill in those comments so that other people that are going to come after you, they'll see what you thought about what we're teaching today. So, Carrie, you want to take it?
Sure, yes, absolutely. Just want to give a shout out to Yolanda Rogers saying good day,
Oh,
everyone, Big Mama from Dearborn, Michigan. We appreciate you, Yolanda, for joining us today. Um, so, Dr. Zarif, in regards to just the information that you are sharing, with the different viruses and stuff, and the things that's going on, whenever it comes to like the what do you call it, CDC, um,
yes.
and the different companies. that report the information, would you say?
Nothing. Go right ahead.
Okay. Whenever it comes to those companies that report the information, do you feel that they're doing a good job at reporting the information, or how do you feel about that? Because even like you mentioned, um, COVID, right? It's not something that we're hearing about anymore, but it is still there. So it almost seems like, um, if they think out of sight, out of mind, they don't really keep us up to date with those kind of things unless you're out actually going out and looking for them, or unless it's something that's considered trending.
Or if it's something that is attacking you or is personal to you personally, like the different diseases, like a person really gets involved when they have disease. They'll like, oh yeah, I got to find out how I can protect myself. And then you have people that are irresponsible that spread the disease knowing that they have a disease. For instance, just like those people that have gonorrhea or chlamydia, those people that have the different herpes, for instance. All of those, when people know they have things, and if they can't be detected, people not looking for signs that they have these diseases, they will irresponsibly, um, you know, have contact with that person. And it doesn't have to be sex. It can be something like if a person has touched something and then your hand touches it afterwards, or it can be the pathogens that come from the a person with the aerosol that comes
Hmm.
from a person's mouth.
Right.
um, and it can also be some of the habits that people have while may not be having body to body contact, but you have a lot of people that like other, let's call it freaky stuff, and that that freaky stuff might be using some type of equipment or something in order for them to get their sexual high.
Hmm.
So there's a lot of things that could be causing it, but it's definitely affecting black folks. And just as I said, especially with people don't hear about HIV a lot, but in 2018, African American blacks accounted for 42% of the 37,968 new HIV diagnoses in the United States and dependent areas. So this is happening all the time. That was in 2018.
Hmm.
Do you think that it's gone down, or do you think that it's gone up since then? It's definitely gone up.
Right. And that's what I was saying in regards to how if it's out of sight, out of mind, you know?
Yeah, exactly.
Mhm.
The viral hepatitis, for instance, is a disease of the liver caused by a virus. The liver is a large and important organ, of course, that helps clean the blood and store nutrients, process food, alcohol, and medicines, and make bile to keep or to help to emulsify or digest fats. Now, when the liver is inflamed or damaged, it cannot properly or it cannot work properly. It cannot do what it is created to do. So it's an interference with liver function. Many people with the viral hepatitis do not feel sick. They don't have any type of clues that they're sick, so they don't feel sick, even though the infection can range from mild to severe. Viral hepatitis is a serious public health problem in the United States and is a leading cause of liver cancer. Now, remember, we talked about this before. I remember when we first started, when some people thought cancer was just one disease, but we went over you can have a cancer of practically anything in the body or outside of it, as far as I'm concerned. The only way to know if you have viral hepatitis is to get tested. So just because you're not leaking or bleeding or you have fevers or some other kind of cue or message or sign like that, make sure you ask your PCP, would you test me for viral hepatitis? Simple as that. The most common types of hepatitis are A, B, and C. And these are the viruses that spread in different ways and it can be passed on before someone knows that they're infected. Hepatitis A spreads through close contact or contaminated food or drinks. So when you are talking, like maybe in a party, if you had a couple of drinks or just feeling real friendly, you're right up into a person's face. So let's just say we'll just call that innocently because you're not doing it like I'm looking to get uh, um, uh, to have contact with this person that to have a disease. Hepatitis, well, back to hepatitis A, it spreads, when you are close. So that means what? Keeping your distance. Remember when COVID was here? Keep that 6 foot distance. Well, now 6 feet may not be what you're consciously thinking, but I would say that it isn't, don't get comfortable with being right up on people. Even these restaurants that have you sitting right next to a person, just enough room for your chair, and then the next is for them and their chair. And when you're talking, you have especially people that go out in groups, 8, 9, 10 people. You have 12 people out here at the along or round table, and they continue to behave as if nothing's happening. And a lot of it, believe it or not, to me, has to do with peer pressure. They don't want to seem like the odd person. They don't want to seem like the person that, oh man, look at her. She got a thing. Take that mask off your mouth. Take that off your face. Take those gloves off, what have you. And these people have a good cause for doing that. I talked about the being close in vitamin hepatitis A. Hepatitis B actually spreads through the blood, the semen, or other bodily fluids. So this can happen through like nicturition, which is your sweating. It can happen doing playing contact sports, drinking contaminated food, drinks and food. All of this is something that keep all these things in your mind so that you'll be able to do something about it. Hepatitis C, and which is, we said A, B, and C. So C is the hepatitis C spreads through contact with infected blood. This is another blood thing. So it's just the hepatitis C spreads through contact with infected blood. Vaccines can prevent hepatitis A and B, and medications can cure hepatitis C. You hardly even hear that word. So it's really one of those things that you have to, these are facts. This is science. So again, to prevent hepatitis A and hepatitis B, vaccines can prevent vitamins A and hepatitis A and hepatitis B, and the medications can cure hepatitis C. So go and get checked out, and don't be reliant upon your signs and cues because you won't have any. It's asymptomatic. Okay, we're coming down to we want to go back over to Carolyn. There may be some uh, uh, comments, or Carolyn might have something on your mind. Let's go.
Thank you so much, Dr. Zarif. I don't see any comments in the chat. If you do have any comments or any questions, go ahead and drop them in the chat. Dr. Zarif is here to answer any of the questions that you may have. But I mean, outside of just the information that you've already shared with us, for everyone that's watching right now, again, we are streaming on Facebook, on YouTube, and on Instagram. So, Dr. Zarif, my thing is, as far as with the audience right now, if you guys have a topic that you know that you would like to hear about or interested in knowing about, you can go ahead and drop those in the comments as well, or even, send something to Dr. Zarif. So our goal is to make sure that the information, or the topics that we're talking about are things that people are interested in hearing about. So I just wanted to go ahead and put that out there as well, because sometimes we may just kind of go off of what we feel may be a good topic, but you have others that may say, "Oh, I wish they would talk about this." So instead of just thinking, "I wish they would talk about this or this topic," you can go ahead and send it to Dr. Zarif. Either, what's the best way? Like,
Just leave it in the comments, and then when we're reviewing
mhm.
the comments, we'll
Okay, so
have.
in the comments, and yes, so that would be one way of being able to do it. Now, even with the comments, if you go and you drop something in the comments right now, or let's say you think about it later on, you can go ahead and drop it in the comments. It won't be considered a live comment, of course, because the stream is already over, but you can also drop it in the comments on the replay, and then that would be another way for us to be able to see it. Okay.
Here- Here's how I got a question, like, do like those people that are, some people are still out partying, and they get, from a couple of drinks they get closer and closer. Do Give me some comments about how do you feel about that? Do you feel embarrassed to wear a mask? Do you feel corny, or you feel out of sorts when you are, um, let's say, looking like you're afraid that you're going to get a certain disease or germs, bacteria around you? Tell me how you feel about that, because a lot of people feel safer when they have a mask on. They feel safer when they have gloves on. They feel safer when they're at a distance. It's just that's what happens today, is how people, the way that people act today, are is pretty spooky sometimes, because a lot of people do have diseases that you can't see. And some people, when they see these, or when they hear about it or think about it, they're talking to someone that have these particular diseases. Some people are very attractive, and they look clean, and they look like they are healthy, but unless you really know by them showing you the results of a disease, or the result of their illness, you'll never know. A lot of people, you never know, because a lot of things you cannot see. Now, there's some things, some other cues, like fever, coughing, aching. All of these things may be some of the things that are like, yeah, you okay? Breathing. We talked about that. So those are things. The other thing is, like, some of us, they get these the mouth sores a lot. When you're talking about the herpes, you have like different breakouts, and you see people that have know the difference between the two, because some people just have like severely chapped lips, and they're making sure that they want to keep it very soft. But there are also things that you want to make sure that you can ask a person. I know this is really weird. How comfortable would you feel if you had to ask a person, yeah, can you open your mouth? Yeah, lift up your lip so I can see. Okay, and down, and stick your tongue out. It might be worth it. Maybe you can wrap it up in playing. playing a little game or something like that, or just simply to tell the person, I want to be closer to you, but I don't feel that, I don't feel safe right now. Maybe you just say, I'm just tripping off of, possibly being able, contracting a cold or contracting whatever disease that a person may have. I know it's tricky. I know it's hard. I know it's embarrassing even sometimes, but you got to find a way. You might have your own way that you find out what you're dealing with, especially those people that are single and free and doing your thing, and you're still dating and you're still um, sharing your, some quality time with someone that you really care about. However, do not sleep on the possibility of them spreading a disease. It's when you find out how bad these diseases are, you don't jump so fast at the chance to put your tongue in somebody's mouth or put your tongue in other areas, and not to make you paranoid, but you should have some consciousness about that, and some
Yeah,
concern.
absolutely. There's Leah Long have a comment
Mhm.
um, in the chat, and she says, I feel safe wearing my mask. I have autoimmune condition and germs creep me out. So that that's a great reason to want to keep your mask on and just to prevent anything from going on with you.
That's right, and I thank you very much for that, Malia. It's just really yeah, that's another brilliant young lady. She's just a sweetheart, and it's good for you to be aware of some things or some situations, because I'm not like I'm free from any fault or anything like that, but I do make sure that I am uh, sharing with you the facts, and some of us don't have to worry about that because we don't live that lifestyle. Some people don't, like they're not worried about it because it's like I know where my lips gonna go. I know who I'm gonna be with. I know who I'm gonna share with, and I know how important it is not to just be, jumping, having the community bed hopper, and or community. Well, I'll just leave this stuff alone. But you know what I mean. You got to stay away from. If you live loosely like that, then you just have a higher risk of disease. If you live more with disciplinary behavior, you have a reduced chance of disease. That makes sense, right? So,
Yes.
yeah. So it's just the thing that we want to make sure that everybody's thinking on that level because it does make a big difference.
hmm
Uh, you
Even
know, go ahead.
I was going to say, even with me when I go to work, and I've mentioned this before, and I still wear a mask,
Hmm.
and I'm probably the only one that wears a mask at work. And I do know you asked the question, if maybe people are looking at you weird or things like that, and they may be, but um, for me, because I know that there are some people who um, don't do certain things that I think they should do, like washing their hands after they use the restroom. Whenever I get to work, I'm always like wiping things down, like the computer, keyboard, the desk where I am, the mouse, things like that, because those are things that people are touching all the time. I'll wipe down the phone and the door handles, things like that, like the common touch areas that I know that someone that was there before would be, touching on that area. And some people at work, they would say that, I know, Carolyn, she's a germaphobe. I'm like, wait, I'm not a germaphobe. I'm just aware of what I see people do. And this is like stuff that I see people do like right in front of me, or even as far as like with the restroom, I mentioned before that unfortunately it's like a smaller area where you can hear the restroom. And if you don't hear that water, turn on in the sink, or if you don't hear like, um, paper towels being pulled from the paper from the dispenser.
Right.
Hey, I heard the toilet flush, right? Right.
Yeah.
I mean, and it's just little things like that that you can pick up on. You're like, ugh, that's yeah, they missed a step. So I go ahead and I take those steps to be able to protect myself against whatever it is that they may leave behind, and that's it.
So audience, what are other things that can you think of anything in addition to what Carolyn just said? Because these are some of the things that can be very important. They might be some of the little things that you can do, but they really account for a huge result, and that is to protect you against some of those diseases that you can't see, and diseases that you can't detect, and diseases that the person, the carrier of the disease, doesn't even know that they have the disease. So it's having a disease, especially sexually transmitted diseases. This is when are also called sexually transmitted infections. These are infections that you can bet that they can definitely change your entire life. They can change your whole lifestyle, won't be as you know it today, and you really can appreciate not having a disease or being able to manage the disease by these particular um, ideas and facts that we're sharing with you today. Okay, so let's see if do we have any comments yet there?
No, no,
Okay.
we don't.
All right. So it might be one of those things that's a little embarrassing, or you don't want to ask, maybe like in public. Okay. But if you get to sit down with your PCP, set an appointment, and I suggest to have a not only a hospital that you can go to, but go to also urgent care center where it's actually like it's a small hospital, and it doesn't have much as many of the apparatus that may be in the hospital, but it does have some. So just start treating yourself more, like you're protecting yourself. And it's beautiful when you can have great sex and great, very emotional and loving experience without the presence of disease, or thinking about, oh God, maybe I might end up getting the heebie-jeebies after this or something like that. You want to definitely stay away from that and protect yourself with everything that you got. Like in 2023, the black and slash African Americans were 40% less likely to have hepatitis A than the United States population overall. In 2023, black and African Americans had 56% more cases of chronic hepatitis B than the United States overall. And in 2022, African Americans were 29% more likely to die from viral hepatitis compared to the United States population. And in 2023, African Americans were 60% more likely to die from hepatitis C. Now remember, this is the curable one, but the hepatitis C than the total United States populations. We don't have to die from there's many diseases that we can find out how we can manage these diseases. Since I was talking a little bit about our sex behavior, everybody loves sex. Everybody loves sex. And when I say that, I always have to leave that room for the exceptional. But there's everybody, even if they're not doing the regular heterosexual bottom top thing, there are ways that people make themselves feel good. Everybody wants to have and enjoys having sex. But when it comes to sexual transmitted diseases or STDs, let's start off with chlamydia. In 2018, the overall rate of reported chlamydia cases among African American or black people in the United States was 1,192,000.5 cases per 100,000 population. Okay, so you can calculate that by also starting with your base would be 350 million in population. It's somewhere between 345 million to 350 million in population. The rate of reported chlamydia cases among the African American and black females was 5 times the rate among white females. 5 times the rate more. And this is very important to know because, again, we must take care of ourselves if we're going to be healthy, change our behavior. Sex is irresistible, is something that, we love. All of us love sex. And when we have the opportunity to have sex, we don't want to endanger somebody else's life because we didn't go and check out ourselves, and now we've infected somebody else's life, and that isn't something that we want to do. Similar ratio, some of the racial disparities in reported chlamydia rates exist among males. Among the males, in this black or African American age, between 15 years and 19 years, the rate of reported chlamydia cases among African Americans was 9.1 times the rate among whites. And I know the first thing that you're going to say is that, hey, black boys be getting it more than white boys. But that doesn't have to necessarily be the case. The case is the behavior, the asserted discipline, the patience. All of those things are part of it. And if you don't come up in a society or an environment like that where people are, you got a dad or a big brother or a cousin or somebody in your face, like I know. It helped me a lot, the brothers that I've talked to and I still talk to stay grounded is very important. Another disease is gonorrhea. I won't go into now because we got to get going. Gonorrhea, the same thing goes for that again. Remember the behavior. Behavior is super important so that you could definitely not be a part of those that are affected with gonorrhea. That's another disease you hardly even hear of anymore because so many other things are taking the attention, like the war. This dude Trump, President Trump. Yeah, he's just horrible. So I don't have a lot of good to say. So I don't want to divert my attention and start talking about him. But things like gonorrhea, sexually transmitted diseases like chlamydia, and primary and secondary syphilis. Now, this is something you haven't heard in a long time, and I know we got to go, but give me a few more minutes, and stay with me for for a minute. When it comes to syphilis, these are cases with known race, Hispanic ethnicity information that occurred among African Americans and blacks. The rate reported that the PNS stands for primary and secondary syphilis cases among African Americans was 4.7 times the rate among whites. It sounds so nostalgic. I'm not nostalgic, but just superannuated. This disparity was similar to the African American or black females and males. Similar disparities were seen in all regions of the United States. Excuse me. So we want to make sure that you have your secondary, your primary and secondary, but you also have congenital syphilis. Now, from 2014 to 2018, the rate of reported congenital syphilis increased 126.7% among African Americans, which was at 38.2 to 86.6 cases per 100,000 live births. In 2018, the rate of reported cases of congenital syphilis among African Americans was 6.4 times the rate among whites. So again, it has a lot to do with behavior. What are you doing with your life? Are you just going ahead and just say, yeah, it's not going to be me? Some people are living in that false reality where they think that they're exempt from the chances of having sex with someone that carries disease, and especially if it's one of those diseases that are embarrassing, like who you going to tell, who you going to share that information with, who's going to be able to help you, where do you go without being exposed. It's a lot of things to take in consideration, but you don't have to do that if you change your behavior. Now, I'm going to do this and then we're going to check on out. Hantavirus, this is something that we hear a lot about. The hantavirus pulmonary syndrome. And this is not so much the animals like the different monkeys or porcupines or wild boars and that kind of thing, but rodents. It's not even that. When we get to rodents, it's really just about what these animals leave behind, and that is their feces. When they leave that behind, or the insects, they leave behind their insect droppings, and this causes and can cause severe breathing problems when it comes to hantavirus, which is the hantavirus pulmonary syndrome. So that keep that in mind. Then the other thing that's these are the things that's prevalent in the black community. Starting off with hantavirus, it's in other communities also. Next of the prostate cancer. Be aware, write this down. You need to know your Gleason score. And the higher the Gleason score, which is a grading system that is showing you how aggressive the cancer may be, or if you have cancer at all. But let me tell you, the doctors are doing a really great job in making sure that you continue to live and have the correct operations for you, so that you will live the best life you can live with a prostate cancer. You don't have to die from it like the past. Then there's the PSA, know your prostate specific enzyme. And these again will help you to detect the elevated levels that may enlarge or inflame your prostate. The other thing, and the word is prostate, not prostate. That's what I want you to remember, the prostate. Okay. Anyway, COVID-19, is it still a thing? Yes, it is still a thing. This is caused by the SARS-CoV-2 virus, which is has a lot of lung infection issues. Respiratory disease is another thing. Organ complications. You got to make that right, because if your organs start to break down or they're not functioning like they're created to function, that can be an interruption of your physiology, and it can lead to something as severe as death. So the danger for older people and people with existing illnesses can be in that category of COVID-19. Now, heart disease is something that's still in the black community, and black people, again, the heart disease is mostly today caused by aging. Okay, before it was like, you're eating too much of this, you're eating too much of that. Unhealthy blood pressure, that's another thing that can cause the heart disease problems, and rhythm problems like tachyarrhythmia. It just depends on how a person pronounces it. And then it's brachyarrhythmia. When you talk about one arrhythmia is high, pumps is when the strokes are moving very fast, the heart is beating fast, and the other brachyarrhythmia is when the heart is pumping at a very slow rate. Okay, let's go on to diabetes. Diabetes is blood sugar management, and the blood sugar management problems. If the pancreas can't make enough insulin in your body, or is when your body is unable to use the sugar properly. So we have talked about that. The different neurological problems that it can cause, the visual problems that it can cause. Sugar is very dangerous for the body. Eating too much sugar is very dangerous for the body. High blood pressure. This is when too much pressure is against the wall of your arteries, and it can cause it is called the silent killer, because this is one of the asocial illnesses that a person can get. It doesn't give you any cues, and it's seldom that you get warnings about high blood pressure. And this is why people eat a certain way and don't work out, and they have high blood pressure, even if they found out that they have high blood pressure. But since they can't feel it, they continue with the same behavior. And sickle cell anemia, you probably haven't heard this in a long time, but this is an inherited blood disorder, and it's severe pain and organ damage. This is a super important note to keep in mind. Lastly, I want to do this, and we're going to go. The Ebola virus. Ebola virus is a fever, body aches, it's bleeding. It can be several things, but gastrointestinal tract really steps out or stands out in my mind. Not all patients experience internal bleeding, but there is some bleeding. As a matter of fact, some people call this the bleeding disease. So keep all of those things in mind, everybody. I appreciate you being here today. We are definitely we're doing things to bring to you what is necessary for you to know to better your health. Okay, so we're going to go back to Kara and see if we have any comments. Thank you we have a lot of people that you've been staying here with us. Thank you so much for staying here with us. We appreciate that, and spread the news. Get the news out to people, and you can really help people. This is something that you don't have to have, but remember, you can change it through behavior. Carolyn.
Thank you so much, Dr. Zarif. I appreciate that. We have uh, Just Step. I'll say Just Step. That's Dr. James Thompson.
Oh,
And he says it's a shame. It's a shame that our current health and human service head want to eliminate some hepatitis B vaccines in young children.
yeah. I mean, yeah, I mean, they got these people. Thank you, Dr. James. I really appreciate that. And it comes to mind that these people they seem to be very, very reluctant to taking care of children or how children count, but they also seem to use children as pawns. The president that we have is accused of having sex with very young female, young ladies. That the young ladies mean they haven't even grown into being a woman yet, and we have that happening. And then we have RFK Jr., which Dr. James is making a comparison with. That he's absolutely right. These guys are saying things like vitamins A, B, and C. These are the ones that there are other. I keep saying vitamins. I'm sorry when I'm talking about hepatitis A, B, and C. But they almost. I can see why I can easily make a mistake on that because more more hepatitis or types of hepatitis have been added to that hepatitis group. It's really important that we know more about this because when RFK, when they start removing certain medicines that are very helpful to people that have these different diseases, the disease can become severe and they can spread even more by that behavior. And this guy is talking about his opinion. The president of the United States is talking about a feeling. I don't know if you've heard, when they were talking about when do you know to stop the war, and he said it's a feeling in my bones or some stuff like that. It's sickening. This dude is just sickening. But that goes to show you that we have to take care of us. Don't sit back and wait for these people that are that we're dependent on to take care of us. Nobody wants a disease. Everybody wants to be healthy, and that's the way we can keep it. If you don't have any diseases now, keep it like that by making sure that you engage in the behavior of better health.
Yes, absolutely. Thank you so much, Dr. Zarif. And thank you for that, Dr. James, for that comment.
Yeah, I know Dr. James that could have been on this one for that. I know he's aware of these things and it's just horrible. Check out Dr. James has a new book. Everybody, what is that? You do we have that? Well, I gotta do better with the address where they can check out.
Um, I'm not for sure. Is it Fearless MD?
Fearless
Fearless
MD.
MD 21? I believe that is. Hopefully
Yeah,
that is.
there. Okay.
I believe
Yeah.
that's the one.
That's beautiful. We got to support our. I love that. One of the things I love about Dr. James is he doesn't wait until you're dead to give you your flowers. He'll say, and according to as Dr. Zarif said, or Dr. Carolyn said, or he doesn't. He'll say it and give you that credit right then and there. And if we did more of that and make our own celebrities and have our own, people of importance when it comes to fitness, health, and medicine and so forth, I think that you will have more. It'll be more helpful and more effective. I know it makes me feel good when my name is mentioned when we're talking about different findings and different might be knowledge that we're sharing and so forth. What you think, Karen?
Yes, I definitely agree with that. Let me see. Dr. James says the book is Fearless Wellness.
Illness,
That's the name of the book.
illness wellness is in the house. So let's make sure every book comes out, we're gonna make sure that we get, Dr. James' book, because I know he has more to come, more
Yeah.
to come. So, okay, let's go ahead and take us out, Karen.
All right. Well, again, thank everyone so much for joining us here on the Mind of Nature. We were streaming on Facebook, or are streaming on Facebook, YouTube, and we were on Instagram. So if anyone, if it cut off on you on Instagram, we didn't cut you off. That is just how that system is set up. It's set up with our system there on Instagram. But you can always, and that's why I say always, go ahead and join us here on YouTube, and don't forget to subscribe to the channel if you have not already. And all the replays will be here or will be on YouTube longer than it would be on any other platform. So again, thank you all so much for joining us. We so much appreciate it. And again, we are here every Saturday, 8 a.m. Pacific time. So Dr. Zarif, back to you.
Thank you very much, everybody, from being here. Really appreciate you all, especially those that come back, those that stay, and those who share. I'm Dr. Zarif, the nutritionist.